Welcome to the Center for Neuroscience educational series. Today I will be introducing to you what is that neurologists do. Neurologists are medical doctors who specialize in the prevention and treatment of disorders of the nervous system. Nervous system can be divided into central and peripheral parts for the sake of simplicity. Central nervous system includes the brain and the spinal cord, while the peripheral nervous system includes the nerve roots, nerves in muscle junction, and muscles. Neurologists are often involved in the evaluation of a wide variety of symptoms. A few examples are headaches, dizziness, ringing in the ears, blurring or loss of vision, double vision, weakness, numbness, tingling, cramps in coordination, balance difficulty, gait disorders, falls, tremors, stiffness, drooling, and incontinence. An important task for the neurologist is to categorize a symptom into a disease or a disorder whenever possible. Neurologists typically do not want to treat symptoms, as symptoms usually point to a disease or a disorder that is well characterized and has treatment options available based on scientific therapy trials. A disease is a well-known condition with characteristic symptoms and signs, known natural history, meaning the evolution of the condition is known and often recognized pathology. A disorder is a constellation of signs and symptoms, but the pathology and natural history are generally not well known. Here are some examples of diseases that neurologists treat: Alzheimer's disease, Parkinson's disease, multiple sclerosis, tumors of the nervous system, ALS, also called Lou Gehrig's disease, stroke, carpal tunnel syndrome, myopathy, which basically means muscle disease. Here are some of the examples of some disorders: migraine, attention deficit disorder, autism, causalgia, concussions. It is important to note that the distinction between disease and disorder is not always clear. A good example is epilepsy, which could be classified as a symptom, disorder, or a disease. Neurologists are usually taught to think in terms of lesions. Their task is to be a detective to answer the following questions. What is the lesion in terms of the signs and symptoms such as paralysis? What level is the lesion, i.e., is it in brain, spinal cord, nerve root, nerves, nerve muscle junction, or muscle? What is the speed of the lesion? Is it acute, subacute, or chronic? And then, what is the pathophysiology? Even in this day and age of imaging studies such as CAT scan and MRI scan, this rational thought process is as valid as it ever was. Only after doing the job of a neurologist can one be sure as to what part of the nervous system needs to be imaged. In the recent years, some popular misconceptions have evolved, partly related to the ever-ready availability of CAT scans and MRI scans. Many people mistakenly believe that a CAT scan or MRI scan is how migraines are diagnosed. The truth could not be farther. Migraines, for example, are diagnosed by a careful history and examination, and sometimes a scan is needed to rule out other lesions of the brain, such as tumors or aneurysms. Neurology is a very broad subject, and it has been subdivided into a very large number of subspecialties. Some examples of these subspecialties include neuro-ophthalmology for visual disorders linked to nervous system, neuro-otology for inner ear disorders, headache medicine, stroke neurology, neuro-urology, epileptology or epilepsy specialists. Neuropsychiatry and behavioral neurology are overlapping fields of brain behavior connection. Electromyography is the study of nerve conduction and EMG, a needle test of the muscle. Child neurology, movement disorder specialist, treat conditions like Parkinson's disease. Neurotrauma specialists excel in the injuries of the nervous system. Neurology is unique in the sense that we are what our nervous system, or more specifically our brains, are. We can transplant the heart, kidney, liver, or lungs, but we will never be able to transplant the brain without changing the person. Brain is hence the king organ of the body. this is also where our mind is located. A lot of mental conditions have at least some evidence of pathology in the brain. These include bipolar disorder and schizophrenia. A lot of neurological disorders, such as Alzheimer's disease, have psychiatric manifestations. The relationship of neurology and psychiatry is very close, so much so the board that certifies the highest level of competence to neurologists and psychiatrists is a combined board called American Board of Psychiatry and Neurology. I hope this introduction helps you understand the role of a neurologist in medicine. If you have any further questions, please feel free to visit our website at www.centerforneurology.us.